We're going?
We're ready to go here. That was
Okay. I'm ready.
All right. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
Valid in our opinion, of course.
And we are live again here. If you're new to our channel and you're watching the rebroadcast, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And if you also want to take a minute just to go over to Facebook and like us, because Brad and I don't have very many friends, and we like to feel wanted.
Yeah, we get that. It takes a whole minute to do that?
I don't know.
Like
You can like this minute. All right. Today, Brad, we're going to talk about morning exercises for back pain, herniated disc, sciatica. What's the first thing you should do in the morning?
Right.
And why is the morning different than any other part of the day?
And there's a very specific reason, something that happens to your spine in particular that happens to no other part of your body that I'm aware of.
Yeah.
And we're going to show you that in a very unique way to do it. So
Yeah, you're going to have to stay tuned because we're going to show you what happens to your body at night.
Right,
So,
exactly.
All right, first thing we want to make sure is that you are sleeping in the correct position, right, Brad?
Right, because if you go to bed and you're kinked up, you're in a bad position, you're going to wake up with back pain. Sometimes even if you don't have back
You're
pain.
kitty wampus.
Exactly.
Is that a common word, kitty wampus?
Well, that's acceptable.
All right, Brad, do you want to show one possible positioning
Right.
scenario?
You can. What is that doing here? We'll take the leg wedge, Bob.
Yeah.
And
It's a real comfortable position for people that are having back pain. You get them on Amazon. Just call it, again, Google leg wedge, and it'll show up.
so the key is you have to get it up tight to your buttocks here. And then you lay it here. And I think Bob and I both have experience with this, or at least 90% of the people are much more comfortable like this than like this, whether it's hip pain, back pain. It's amazing what this little device will do.
And then if you want to add to it, you might even put a lumbar roll underneath your back when you're laying underneath your back like that.
And we just have a towel roll. You don't have to go out and buy anything. You can just roll up a towel or a sheet and get it around here like this. You don't get it tight. You just have it so it's there.
So now it's in place when you're laying on your back, but also Brad lays on his side. It's still filling in that gap.
Right.
And while Brad's on his side, you might also throw in a pillow here. So,
Yeah. You can give me a pillow for my head too, Bob, so I can be comfortable.
by the way, I see we're getting lots of comments already, Brad.
Oh my God, these people are incredulous.
We're really glad to have you all. We're going to try to gather some questions at the end. We're going to try to get through most of our subject matter now. We might say a couple highs, but right now we'll stick to. So anyway, this is a very good position for your back. Pillow between the legs. Got a little bit back support here, and then of course you got the pull for the head.
Right.
All
So,
right.
you know, this is one option. I personally don't use that one. I personally use this one. But every back is a little different. Every body's a little different.
And you could try this with pillows. It's not really as good.
No.
We're not trying to sell leg wedges, but I'm just saying it's hard to replicate that.
It's very hard. I've had a lot of patients try to do it.
All right.
So, what are we going to talk about? The back. What happens over the night while you're sleeping that makes getting up in the morning very unique and can be very painful?
All right, let's get up. We're gonna do a little close up here.
All right.
I'm gonna even move this up just a hair so you can get me in here.
Okay, so we're going to look at the spine itself and break it down just to two vertebrae. I got to get my glasses on, Bob. You know how it is.
So these are two bones he basically took out of the back, and there's the disc that goes in
Right.
between them.
Your disc is not a round ball like that, but your disc is like this in the sense that there's fluid in the middle of the disc, and there's a tough outer shell, if you will, and it's flexible. And here's one vertebra.
From Jordan, we got Emma Cole from Ireland.
Oh, Ireland. I want to get there. I want to get the
Deborah
Guinness.
Newman.
Okay. Yes. Okay, here we go. Now, I'm going to talk about this. Here's the vertebrae, and this represents the disc. When you're standing, your body weight goes down and compresses the disc. And as it's doing that, your annulus, the outside of your disc, is porous. Not a lot of big holes, but small little holes, and fluid exits the disc. And throughout the day, the disc actually gets smaller and smaller, and the fluid is exiting it. When you lay down on your back, that weight pressure, the body weight, is coming off of there, and the opposite happens.
Right.
Where the fluid and nutrients go through the annulus into the disc, and the disc actually gets bigger. So if you look here, I got 1 finger width, but by the morning time, we may be able to put 2 fingers in there.
Sure.
Now, obviously, I'm just making reference to size. You don't get near that kind of growth.
Right.
But in the morning, all your discs imbibe, get that fluid in, and you're a little taller in the morning. Now, if you've got a disc that's injured, Bob, you got that herniated disc or one that's bulging and it accepts all this fluid and it's got a little more fluid in the morning, and when you stand up and it's full and it's kind of bulging already and there's pressure on the soreness of that disc, and then you stand up and the weight goes down, that can be a little more painful.
Or if you bend forward in the morning.
Exactly.
Which can cause the herniated disc. You're more susceptible to hurting your back in the morning.
Exactly. Because of imbibition. We're not talking about imbibition.
Imbibe.
Yeah, you're not imbibing, drinking alcohol, but the body's imbibing, taking the fluid in. So I like to think of it, Bob. I don't know if you're going to like this, but all night long your discs are imbibing. They're like having a party all night long,
taking in fluid.
Right, and then you get up in the morning. If you've got a bad disc, I mean, that disc kind of wakes up with a hangover.
Right,
and it's a problem.
So you want to be very careful in the mornings. I mean, I think that's what this all comes down to, Brad. Right? That you want to make sure that you're not doing anything a little wacky in the morning.
Right.
But one of the first things usually, Brad, you want to try you want to start getting some movement right away.
Right.
So.
You want me to?
I can do it.
No, go ahead, Bob. You're better at this than I am.
So the first thing you might try is, we're talking about just laying supine, right? Right, Brad? Like laying flat on your back.
On your back in the morning,
And you can start off just by doing some pelvic tilts.
Right.
Is that what you're doing?
So pelvic tilts. Some people have a hard time doing this, but some people. Can you do it, Bob?
Yeah. So what we're basically doing, I'm flattening out my back. If I were to put my hand underneath my back here,
right there.
I'm flattening it out, so I'm squishing the hand.
Right.
So I'm tilting the pelvis here. It's just a way of getting some movement in the pelvis.
Right.
And kind of knowing where your pelvis is at without too much stress on it.
Right. So you're gonna do it within a pain-free range. If it starts to irritate it, stop doing it. If it starts to create pain down the leg, for sure, you need to stop it. But typically, it's not going to be a problem.
The gold standard one that we pretty much, Brad and I have almost everybody do, is trunk rotation.
Sure.
You wake up in the morning and you want to start getting your back moving, getting that fluid moving, getting the lubricant moving, and you're going to find if you can go both directions, great. If you can't, just go one direction. And if you go further, go further.
Right.
But I'll keep it within pain-free range.
Exactly. That's the key, is motion without irritating that back pain.
What am I doing next, Brad? Now am I going on to my side?
Other than take a nap.
Oh, we talked about knees to chest.
Right.
If you're having arthritis type pain, or if you have spinal stenosis or spondylolisthesis, then you can do some of these.
Right.
If you have a disc problem, sciatica, you don't want to be doing these.
Right. You don't want to flex the spine.
Knees to chest.
Particularly both knees in that
Knees
case.
to chest, and then this way like this. This would not be a good thing to do.
Right.
But this would be fine for arthritis.
Sure.
Again, as long as it's pain-free.
So know what you have.
So then we're gonna roll ourselves over like a log.
Yeah.
Over onto our stomach.
Now, if you're in the middle of a flare-up, you're going to do this very gently.
Yeah.
And keep things intact.
And now in the morning, you may want to just lay here for a little bit, maybe set the alarm for another 5 minutes.
Yeah.
And then maybe you won't even get up on your elbows just for a little bit. If you have the TV in there, watch a little TV. And then eventually you're going to try to do some press-ups. Start getting that back warmed up here. And these are these extensions.
Right. Now, you're going to do this depending on how your back responds to it. If you've got a major bulge or a herniation, it might be too early. It might be just baby press-ups. You want to be going up a little bit.
Yeah.
But then the next day, as things improve, you may be getting up higher. So as long as it feels good and the leg pain is resides from it, yep.
Generally, the further the better. I mean, we want to try to get you up further and further without lifting up the pelvis.
Right.
So now this puts you in a good position right for getting out of bed, Brad, because then now you can go ahead and slide to the edge of the bed, and you can get your feet off like this. You can do a push up like this, and look, I'm keeping the back straight the whole way.
Right here.
This method saved me when I had a bout of back pain, because there was no way I could get in bed or out of bed without using this technique. So I got in this way, keeping the back straight the whole way. And I got out, I rolled over then, and then I got out the same way. Another way, Brad, is just to, you can try this one, roll onto your side.
Right. If you're not really irritated, this will be the next
And then
step.
get up like this. The worst way to do it is to get up like this.
Yeah, we have to do the old stomach curl.
All right, what's next on the list, Brad? You want to avoid leaning forward, don't you, at the bathroom sink?
Right, so usually people, once you get up on your feet, you know, remember we talked about all those, you know, discs are getting squished a little bit now, so give it some time, walk around, try to work good posture, but typically, you know, you gotta get out of the day, so you're gonna go to the sink. And what's the first thing you do is if you wash your hands, you brush your teeth, you're leaning over the sink a little bit, and you're probably not even aware of it.
Well, the worst thing would be if you're washing your hair in the sink.
Oh, right.
Yeah, I mean, you'd be, I wouldn't even recommend that.
Right, yeah, might as well just shave so you don't have to
Yeah,
wash.
so,
But no, that leaning forward a little bit can make a big problem with your back, so make sure you got good posture, and you're just gonna have to get right up to the sink, and, you know, it can make a little mess and make a little mess.
the other thing is, as much as you can throughout the day, whenever you do bend forward, try to support yourself.
Right.
You know, I mean, if you put your hand on the sink, that's gonna take a lot of stress off your back.
Exactly.
Keep your back straight.
Exactly.
So, you said no bending over to pick up the soap in the shower?
Right.
What are we, in prison? I mean,
Bob, it's true. If you wanna pick something up off the ground, I don't care what you were doing, whether it's in the shower, you're gonna go like this and lift with your legs and keep that back as straight as possible. As far as taking a bath, if you're a bath person, just forget about it. Don't take a bath when you got a herniated disc or sciatica. That sitting with that warm water might feel good, but it really rounds out your back, putting the undue stress on that disc, making it worse.
Yeah, Amy Chen says, you know, keep the back straight the whole time. That's a new habit I've had to remind myself constantly, and it's very helpful. It is helpful.
All right, thank you, Amy. So the other thing is, we want to talk about getting dressed.
Getting dressed,
right? Because you got slip-on shoes, right?
Yeah.
Can you demonstrate how you're going to get your shoes on?
Well, one thing you don't want to do that, you know, like this, I mean, this would be a little better than going down like this.
Right.
But really, the best way is actually, Brad, to get back onto your back and put your legs up like this, and this is how you best do it.
Right.
I mean,
So
you'd have your shoes in bed, you're by the bed ready
Right.
for you.
Well, I just have my wife do this for me every day.
That would work too, but you can see I can just go like this and slide them on. The same with getting your pants on. I mean, you're gonna have to probably have them in bed, because you can't bend over.
Right. So we're not doing this to put our shoes on, or doing this to get your pants on. You do it while laying in bed and your back is supported on the bed in that horizontal position. Work with it slowly, and it's amazing how much better it works.
You want to talk about lumbar support then, Brad?
Well, of course, Bob.
And here, give you a couple of supports. We got lots of them, don't we?
Right. Yeah, let's get that one too. So throughout the day, first of all, sitting in soft couches, you want to avoid that. Like especially when you get out of bed in the morning, if you have a soft chair that you like to sit in to read the paper or watch the news, whatever it may be, get a firm chair. Firm, upright chair is going to be the way to go.
So wash machine, that's what it name says, with push-ups, my back hurts more. Is this normal? I don't think meaning push-ups as far as regular push-ups, or if he's meaning press-ups.
Right.
Either way, you really don't want to do anything that increases the pain
Right
now.
Exactly. If it hurts,
Sorry about it.
nope, that's all right, Bob. I can be bothered. So lumbar supports. These are meant to support your lumbar area. That's why they're called that, which is at the belt line area. And you put that in a chair, and you can put this in your car. Works well if you got to drive to work in the morning, or sitting in a chair at home. You know, in the kitchen chair, you may have one here. I don't know. It's kind of hard to see.
You can see, again, you can start with a roll of towel to see how it feels.
Right.
Because we actually have one right here.
Yeah. So you can start out with a rolled towel, because you don't want to go out and buy stuff if you don't know you need it. But typically, you know, this is a good way to start. And this can work, you know, long term as well. Actually, that's just about right for me. The diameter of the roll is going to vary depending on your back problem, the size of your body, the shape of the chair.
Right. A larger person needs a larger roll.
Right.
And a lot of times, I found that people who are really having bad back pain, sometimes they like the larger roll.
Yep.
Say, Andrew E. asked, what about knee pumps for disc and hydration? Yeah, there's that theory, Brad. You know, some people that when they're laying down like this, and you're supposed to pump like this but I would not do that with a disc problem.
Right.
I could see you doing it if you have like arthritis or something like
Sure.
that. But if you have a disc problem, I would not. be
Right,
doing
you know, years ago, back in the 50s, I think the Williams flexion exercises were very popular, and some of that maybe is carried over from then.
Right.
But in general, that's a thing of the past.
Yes, it is somewhat of a thing of the past.
There's exceptions, but we're talking the majority here. I do want to show one more lumbar support. This is a really nice one. It's shaped, it's not round, but it's a little bit wider, which sometimes can be really advantageous.
Someone
asked more in the back.
Brave Red Golden said in the previous video, we mentioned when the pain is no longer in the back, but it's consistently in the leg, that's a bad sign. Can you explain that? That generally means that the disc is so extruded or protruded, or that it's just pushing on the nerve, and
Right.
it's a bad sign. Often, I mean, it means you might be heading towards surgery in some cases.
Sure, if you just have the numbness tingling all the way down into the foot, but the back feels fine, you know, I guess it's possible. It could be, you know, a stenosis can be that way.
Right, or it could be, if it's numbness and tingling, and that's all it is,
Mhm.
then it might just be the nerve needing to recover yet.
Sure.
But if it's pain going down into the leg and nothing in the back,
Sure.
then I'm more worried.
Right.
The numbness and tingling, I don't know if I'd do anything about it besides keep doing what you're doing. You know, as far as
Right.
exercise.
It could, you know, another thing, it could be that we're talking about the discus possible, the piriformis muscle is pinching it.
Sure.
And we've worked with that as well. And that's
A lot of different
stretch.
possibilities,
Right, yeah. This can get pretty complicated.
It can.
We're trying to cover the majority of the issues, so these are good questions.
Roxanne Olmsted, and she said that she starts therapy on Tuesday. She's in the McKenzie method, but she has spondy. So in both legs with DVD.
So Roxanne, if you've got back pain or spondylolisthesis,
Which Brad is, by the way, I don't know if you know that or not.
Yeah, I've been diagnosed with that for 8 years now. I had it before that, just didn't know it. But anyways, that's a good time to get a therapist involved.
Yeah.
You've got more than one thing going on.
But you're generally not going to do the traditional McKenzie method.
Right.
McKenzie will do flexion too.
Oh, right.
So,
That's
I mean,
it.
a McKenzie therapist will know what to do.
Right,
So-
yeah, because you can combine the extension and the flexion or
Yeah.
however it may be, but yeah, go to your therapist with that because it's gonna be hard to
It's a
figure
little
out.
more complicated problem, so. What are we talking about now, Brad?
Well, I pretty much went through everything. I just wanted to see if anybody else had some questions. I
Lord
could help.
Jesus, thanks for the roll towel, it saved me.
Oh, sure.
If the pain stays in the back, does that mean it's getting better? Legacy bypass? It usually does. It usually means, you know, usually the pattern is, it goes up to the butt, then it goes into the back, and then it starts to narrow up, and then it goes away.
Right, and it is amazing, you know, one of the things that we'll ask is, how big is the pain in your back? If no more leg pain or symptoms, numbness, tingling, that's all gone in your leg, and in the back it starts like a grapefruit size, and it's off to the right-hand side, and then if it moves more towards the center, that's a good sign. If it moves away from the spine, then, you know, something's not right. So you need to centralize it, and then it gets smaller and smaller and smaller. And it's neat how well this works. So McKenzie really did a nice job of discovering this and working with it over years.
So Mr. Dub Rowe says, I cannot replicate the feeling in static positions. When he tries to cycle, I notice feeling becoming more pronounced when climbing. This is only present on my left side. Yeah, we have a whole thing on biking, right? Don't we?
Right, he's saying only when he gets on the bike he's having
It sounds like
the
it.
problem.
Sounds
Yeah, boy, you know, if you can watch some of our videos on bike positioning, and we just did some not too long ago. I don't know if they're going to be up either this month or in July. Make sure you search our channel for that, because I talk about forward bending on bikes, particularly if you're on a road bike. It's maybe more pronounced. So I don't know the details there.
Frank O'Gara asked what's the best exercise for a bulging disc. That's the same for a herniated disc. You want to do the extensions.
Sure.
You want to get down on your stomach, and you're going to want to do these. You're going to want to do these press ups. Again, you can do these every hour. You can
Sure.
do these. You can do 10 to 15 every hour, as long as they're pain free.
There are going to be some situations where you have a bulging disc or herniated disc, and this particular exercise won't work. You're going to have to modify it a little bit. And we've got some videos on advanced exercises. And we really can't go through this. We could spend another 20 minutes just on that, but keep that in mind. And there are some modifications to that exercise to make it successful.
So David H., any tips for sciatica relief while driving? Yeah, the big thing is, one, keep your seat upright. Two,
lumbar roll.
Use a lumbar roll. And then 3, take lots of breaks if you can.
Right.
I know that's also maybe impossible on your commute, but and limit your driving as much as possible. Don't do any recreational driving. I mean, on the weekend, if you can get away from it. I mean, you take the break and you walk around the car and try to get some movement, and maybe do some of these back extensions, standing back extensions after you've been driving for a while.
If you got a car with bucket seats and your seat dips down and low, I had one person, we just put a cushion in her to lift her buttocks out of that hole. And that was a great helper right there. I think she had this little old Toyota. It was an old car back in the 70s. She almost sat on the ground when she was in there.
Yeah, my daughter has a Corolla, and it's bad.
Yeah.
It's really bad.
Well, the car might not be, but the seat, the seat itself, for a bad back pain.
So again, Wash Machine says, after extensions, my back hurts more. Is this normal? No, it should be. Again, you may need some modifications.
Or it may not be a bulging disc. It may be a different source of pain, like from the facet joint.
What's wrong? My range of motion hasn't changed after months of physical therapy. I'm sorry, I don't know if we can help you.
Right. Just going like this.
Yeah, we don't know. We're looking at you. What's going on?
Keep in mind, when we got a back problem, when we do an assessment, it takes usually about 45 minutes to do a complete assessment. And on some of these, sometimes we can come up with a pretty straightforward answer. Otherwise, we need a little more detail that we cannot get on the internet.
Right. All right. I don't know if we can do anything else, Brad. I think we maybe better wrap things up here.
Yeah, we got people waiting for us out in the clinic as well. We don't want to stop them.
Thanks everybody for watching.
Enjoy the day. Be careful.
Yeah, be careful out there.